one question that does come to my mind is that this is data that belongs to people like me, right? Are there like any sort of regulations in place?
I mean, there's more and more regulation coming in around the privacy, and it's very possible to protect the data. That is very possible. Yeah. And politics get in the way. I just have to say it. Politics get in the way. I think with COVID, that was very interesting. In many countries, it wasn't a huge impact, and they still had people dying every day of malaria. And so malaria was still, they're like, this is actually still our priority over here. Is not COVID, it's malaria. Fragmentation is a huge challenge. And I think we're really seeing ways to address that. Roughly probably 80% of what goes on in a system, of what you want a digital system to do, can apply anywhere.
Hello and welcome to a brand new episode of the YO.DH Dialogue, a podcast where we deep dive into conversations about digital health along with experts from the field. YO.DH Dialogue is an initiative of YODH, which stands for Youth Ownership of Digital Health, and is a community of young digital health professionals. And I'm Kopal Khanna. I'll be your host for today. Well, conversations around digital health and health equity are the need of the hour. Asking questions like, how do we create a world where everyone has access, are extremely pressing. And our guest today is very, very special because she spent a large chunk of her life asking this question and also working towards the answers. Laurie Werner is the director at Path's Center of Digital and Data Excellence. She's leading initiatives to promote health equity through digital innovation and data utilization. She has over 20 years of experience in international development and public health. And today, I'm extremely honored because she is taking out the time to chat with us. Hello, Laurie. How are you?
I'm well. Thanks, Kopal. It's nice to be here with you.
Yes, likewise. I'm super excited to kind of just deep dive into this conversation. And I have to say up top that I love your backdrop. It's just looking super dreamy with the books and the wall and the white door there. So super.
Well, thank you. Yeah, this is my home office in Seattle, Washington, in the United States, far away. But thank you.
Nice. Well, reporting from my home office in Jaipur, India. So, Laurie, just to dive right in, I would really love to understand one thing from you. We're all aware the world has just lived through a global pandemic, and conversations around health equity, digital health are becoming more and more important. And I think every single person has kind of understood the importance of it. I would like to understand from you that globally, at a policy level, at a grassroots level, how have these conversations changed in the last couple of years, keeping like a macroscopic lens, because the pandemic has just happened?
Yeah, it's a really great question because the pandemic really did have a tremendous impact on digital health. Yeah. In my experience working in digital health over the last 10, 11 years, so much has changed and evolved during that time from what we were able to do 10 years ago to what we're able to do today. But throughout the time, most of my conversations with funders and donors and even, global agencies and others, and even sometimes country representatives was like, digital, I don't know, can we do that? Some people wanted to, but there was also the it's so expensive. We'll never get rid of paper. Paper will always be the best tool. And that has shifted completely 180 degrees with the pandemic. I think because, everything was shut down, we all learned how to use, virtual ways of communicating and interacting. And the demand for the data and the need for real-time data became even more apparent. Not that we didn't know that before. We knew it, but the absolute need for it was emphasized to everyone. And digital became now okay, this is something that the technology has improved tremendously too. So it is actually feasible, but now the demand is there, and the realization that this is actually going to have huge impact, and it's something that all countries now want to do.
Yeah. Well, a prime example of that is that I'm glad that we are able to have this conversation.
Exactly.
Probably, doing a podcast virtually was, I think, in 2020, not not something that somebody would think of, like recording it, putting it up online. But here we are. So clearly, even at such a minor level, content creation level, that conversation has changed, where people are okay with just technology and digital stuff.
Yep.
So yeah, completely. Laurie, just kind of taking from there, you mentioned that people are okay with more conversations around digital health and data, and people are becoming more and more okay with it. Just to kind of understand, how does data collection, just a very basic, how does data collection work? Like, how do you decide that this is where I need to collect the data from, or this is an issue where my team needs to go intervene, collect data, and then we need to kind of follow the processes? If you could just take me through just that very basic level understanding of how that works.
Sure. I mean, it really differs, and it depends on the context. I think for so many years, we didn't have population, like people-based data, right? It was much more that in clinics they would, sort of tick like tallies of, they call them tally sheets in many countries, of how many people they immunized or how many pregnant women they saw this day. And then they would send that aggregate data on paper to, the next level, to a district office or whoever. Maybe they would enter that into a database. I mean, I think databases and national platforms have been around for some time, so that then the national level managers could have, okay, we have, immunized this many, vaccinated this many people, we have, but it's all big numbers. That the shift is really began several years ago, or many years ago, thinking about how can we collect actual individual patient data, right? And doing that, that's where digital really plays an important role, because, there's health cards that people have, that they carry with them, that they might bring to the doctor or to the nurse. But often what happens is that the health worker becomes the data collector, right? They're the ones seeing the patient, but they were doing the tally sheets, and now they're filling in the health card, or they're doing, the app, like they've got it on their phone and they're putting it in the data. So they're actually the data collectors often now. And the challenge is, there are pictures out there and documentation that we have fragmented systems. So the malaria program, they have their own app. The immunization program, they have their own app. The, maternal and child health may have, and they may have different devices, right? Because they may give them, okay, here's your malaria device, here's your HIV, TB device. And so these health workers it becomes, cumbersome, actually. And I think that's a real challenge we're facing today. But that's generally how data are collected. There's also surveys and other things, but routine data, that's generally how it's done.
Wow. So, I mean, I can't imagine, like, across the world, we have collected so much data around health. And so how does, I mean, one question that does come to my mind is that this is data that belongs to people like me, right? Somebody is probably coming when I'm going to the hospital, or either coming to my community or my home and asking me details about, my body and my health and my family history, and then, taking it to for research, perhaps, right? So the very first question, as somebody who's perhaps data has been collected in the past that comes to my mind is that, are there like any sort of regulations in place, or some sort of uh, I don't know, ethics in place, where we are kind of trying to understand that, okay, this is the limit to using this data, and this is fair use of this data. Is there something like that in place when it comes to health?
So there is more than there used to be, but there needs to be more. When we started doing some of our work in immunization systems 10, 11 years ago, there wasn't really anything. GDPR didn't actually yet exist in Europe. We had HIPAA, which is a law here in the United States, but many of the countries we were partnering with in Africa had nothing. And so that is very important, because this is the risk. There's a risk with digital around greater access to data that is very sensitive data. It's also important. It's also a great opportunity for the patient. Like, we can maybe have better access to our own data, but can we give permission around how our data are used is really important. And so more and more, like Kenya has passed laws, I think India has, there's more and more regulation coming in around the privacy and how to do data sharing and those pieces, but more is needed, because many countries just haven't had that chance to develop that type of legislation yet and really understand what they need as a country to really protect their citizens' information.
Right. And the flip side to this conversation also is that we have to collect the data, right? Because that's the only way we can kind of make progress in the field of health, and we can give the universal health coverage to everybody, So I think, of course, there'll be more and more conversations around regulations and laws, but the primary thing here is that collecting data is very important if we want to reach our goal of universal health coverage, right? So just to kind of backtrack, Laurie, could you just break it down for us? What is universal health coverage, right? We, of course, hear a lot about it, but I would love to understand from you that what is it in the first place, and why is it so important in today's times, especially?
And I think it's always important, but it is especially important with what we all just lived through with the pandemic as a great example, and many other, health challenges that the world has. Universal health coverage is really ensuring that every person in a country, in the world, has access to quality healthcare. I think that's a really important thing to note, because it's not just any healthcare. Like, we want it to be a good quality that will actually serve the patient. And this is actually where digital can play a really helpful role. It's very possible to protect the data. That is very possible. You just need to build the systems in the right way to do it, and have the right regulatory authorities watching and making sure it's happening. But the ability of digital to ensure that the systems across the country are connected, exchanging data in the right way that can really, because when you have those siloed systems I was referencing, malaria data over here, HIV data over here, it's the same person maybe who is, had malaria, goes for HIV, but their data is separate, and it's very, very difficult then for governments in particular are we serving everybody? Does everybody have access? Who is everybody? Where are they? So that's the challenge that many countries face. I think then obviously financing is a whole other piece with universal health coverage, and with digital too, is that these things need investment. And universal health coverage needs investment to ensure that the systems are in place to ensure that all the population of a country is served and has access.
Just I love what you said about who is everybody.
Yeah.
That is such an important question to ask. Who are we catering to? When you say universal, who are we actually including and not excluding, right? That is such an important conversation to have. Like, if I just talk about where I come from, which is, Uttar Pradesh, a state in India. There are so many small villages, that, like, are we actually going there, getting the data from there and ensuring that there are hospitals and access in those very, very small, villages? So it's such an important question. And that kind of leads me to my next question. You did kind of touch upon some of the challenges that one faces, but uh, um, I would kind of love to understand from you that I know it's a very like it's kind of a utopian question in some sense, but it's obviously a beautiful world where everybody has access to health and is living a healthy life, and at least is getting an opportunity to live a healthy life, right? But how far are we from that, so to say, dream of having universal health coverage across the globe? Uh, yeah, I think that's it. I have a second part, but I would stop my question here, and I would love to hear your answer.
Oh, I wish I knew. I
Yeah,
think we're
yeah,
much closer than we used to be. I mean, I think
yeah.
to not be a total pessimist, I'm an optimist by nature. I
Yes.
We have made tremendous progress. We have. I mean, just even particularly, like, I have a background in immunization. I've done a lot of what I have worked in. And if you look at the rates of immunization over the last 30 years until the pandemic didn't actually cause a lot of decline, but there's increase, which meant actually more access, right? More people and more children were having more access to vaccination services. So there has been tremendous progress. I think there's a lot of hurdles still, right? I mean, financing being one, knowing the populations is another, because remote villages, like you said, urban slums, right? There are a lot of urban centers where that's always a challenge to know what is our group that we need to reach out to. How do we know if we've missed anybody? So I think that's why I would think it's hard to quantify like how close we are. And politics get in the way. I just have to say it. Politics get in the way. We always say, I don't even know where this came from. I feel like I should know so I could credit someone, but the digital work, the technology is not the hard part. The socio-political is the hard part.
Right. Wow, that's a beautiful one, because it's so true, right? There's so many stakeholders involved, and really, what you said about being an optimist. I mean, you and I have to be, like, especially you. You have to have that. That optimistic attitude towards this, because how else do we bring about change, right? And of course there will be multiple hurdles, because there are multiple stakeholders involved. And I can totally imagine, with so many people working to make something happen, how tough would it be to see it from going from point A to point B. And that kind of leads me to my next question, and that is essentially, could you, Laurie, take me through the process of how does one identify that this health problem, like you did mention malaria, HPV initially, how do you kind of identify that this health problem is pressing right now? It needs our attention. And then what is that process of kind of identifying that problem, and then also kind of working towards that problem? How do you navigate different stakeholders? Who are these different stakeholders? And how does that entire process work? You can also tell me this using example of maybe like a case study that you've kind of done in recent times or in the past.
Yeah, I think, because the sort of the world we work in with digital is sort of health area agnostic. It can be, right? Like, we ideally are looking at the whole health system, but that's why it's important, because to really what we really focus a lot on is what are the country's priorities, right? Because the government really has a sense, even if they don't have all the data and information, they have a sense of, they know what their priorities are. They know what the leading, cause of death is in their country. They know why, people are coming into the facilities. I think with COVID, that was very interesting. In many countries, it wasn't a huge impact, and they still had people dying every day of malaria. And so malaria was still, they're like, this is actually still our priority over here, is not COVID, it's malaria and whatever else. So I think that's where, for at least in the work we do, as an international NGO, is really understanding what a country government's priorities are and helping them to architect really what is it, then what digital and data systems do they need to help them address those challenges. I do think one of the, like you're kind of getting at a little here, is there are so many stakeholders, and this is where our current model, that so much work, health work, is funded by donors. Those don't often match. A donor priority does not often match the country's priorities, and that's a challenge. And that's a challenge that we try to bridge by really working with governments to say, okay, what is your digital strategy? What is the roadmap of investments you need to realize? And this is thinking of the whole health system. And then what is the architecture, how you want it to look? What systems, how do they connect? And having those, so then that can be, here, funders, this is what we need. And actually, it's, in some countries, it's helping quite a bit, at least, to coordinate. So I think for us, it's definitely, the health challenge is really what the country's got, what they're prioritizing, and how can it support what they want to achieve.
Right. Right. So, just to kind of take it from here, you did mention a few challenges. Of course, there is the politics that's involved. There is the finance that's involved, and this one that you just mentioned. If I could, Laurie, kind of ask you, what is like the number one challenge right now? Like, what would you say that, okay, this is something that we really need to address at this point, and everything else is very important, but this is like the number one most pressing challenge in the digital health ecosystem right now?
Ooh, it's hard to choose one. Because I've named a lot of my favorites. I think, financing and how that works is one. I'm going to name a little bit of a different one, though, because I kind of referenced it. I think that the fragmentation of health programs and the way they're funded, so I get my funding in there, is making it very difficult to achieve what everyone wants to achieve of universal health coverage. Because we're not able to like bring it all together into a whole, to look at the health system as a whole and let the national, leaders be able to make decisions based on that. Instead, it's sort of in different pieces. I think there's progress is being made to address that. And in the digital health world, it's being done through, okay, you're going to do a system that's just for this. Make sure it's built to open standards. Make sure it's interoperable, because then it could communicate with the national, HMIS, right? Like they could communicate, because there's no necessarily one system that's going to solve everything. That would be a lot. We just need to be able to be thinking about how they connect and share data. So fragmentation is a huge challenge, and I think we're really seeing ways to address that.
Right. So it's almost like, everybody's trying to solve one puzzle, but then there are different pieces everywhere. So nobody's actually seeing the bird eye view to see where the puzzle is going. Yeah.
Yep.
So to tell me something, Laurie, is it possible? So since we're talking about this whole piece of fragmentation, how different people are working on different things, and you're kind of seeing like a holistic picture is a little bit of a problem. For instance, since you've worked a lot in Tanzania, South Africa, if we have done like a project or a case study in these regions, um, how, for the lack of a better word, how easy is it to kind of scale it to other low income, middle income countries?
Yeah, that's a really important question because I think there's sometimes an assumption that it's easy. And I think that misses every country has its own context and has its own needs. Often though, with the digital system, there's some basic pieces. So we call like the pieces, like the elements inside a system, we call them requirements. And roughly probably 80% of what goes on in a system, of what you want a digital system to do, can apply anywhere, can work fine anywhere.
Wow.
It's that other 20%, right? It's that other, and that's often about like what the user sees, right? That's language, that's visuals, that's what kind of report, that's whatever things that are actually more upfront. And so I think that's happening a lot. There are systems that are in multiple countries, look kind of different in each country, but the base platform has similarities. And I mean, like Microsoft, we want to think about that, but DHIS too, that's a big one. Many countries have it, and but they can contextualize it to the use case they want to use it for, to the country, to the language, to all the pieces. So I think that's the important thing, that with a lot of what we do is there are things that have happened in other countries that it doesn't mean you take exactly from that country to apply it to others, but sort of the base, right? And there's sort of the WHO and ITU put out over 10 years ago the e-health building blocks, and those we've used a lot to really think about the holistic nature of digital transformation, policy, strategy, infrastructure, workforce, all those pieces. And every country has all those things. Their workforce might look different. Their infrastructure might look different, right? Some countries have much better infrastructure than others. So it's just kind of the same elements, but adapting to different settings and countries.
Yeah. All right. Okay, that makes a lot of sense, and 80% is a great number. So as long as we can figure out the 20%, I think wonders can be done across the globe from like a particular study in one region. Laurie, from my understanding, you have spent a major chunk of your life also on field, right? Actually traveling to these countries and being a part of research work on ground. I would love to hear from you about maybe one case study or one project that you were personally involved in on ground, and just if you could just take me through the process from like A to Z. How did that kind of work, and what's the process like?
Yeah. Well, I mean, I think the first one I was involved in for digital, this was the one about 10, 11 years ago, the Better Immunization Data Initiative that we did, partnering with the governments of Tanzania and Zambia they really wanted to think, how can we improve the quality, use, the collection, the quality, and the use of our immunization data to improve immunization services. And there weren't as many. Now there are many different platforms that are being used for immunization, digital platforms for immunization. There really weren't that many. And that one, I think for me, we really did it very much user-centered design approach. So we had what we called user advisory groups in each country that were made up from community health workers, nurses, doctors, district managers, national logistics managers, to really share what they needed, what kind of data or information they needed, What did they need? Even thinking through how the health workers like we spent time actually in a clinic with them, and we're like, okay, so you weigh the babies over here. Okay. And you need to mark that down on the paper over here. And then they come over here and da, da, da. And it was just sort of, so just really kind of thinking through how does that actually affect the digital system, right? Because, like you could have two tablets, or you could, do it all in one place, or do you know what I mean? Or something. So it's not even just the digital tool. It's really like, how do they do the business? Like, how do they do it? And then how can the digital system support that? And that, for me, that was my favorite part, because, watching the health workers really, like, I don't want to say, I almost want to say play, they were like, ooh, we could do this. Ooh, and then as they got to be such pros, they're like, look, here's our report. These are the children coming in today. They got so proud because they had a tablet. They were able to they just had information in their hands, and it was really inspiring.
Wow. Laurie, when you talk about, the space, I can see, especially these experiences, like when you're speaking about the kids, your eyes kind of light up. So, you're obviously super passionate about what you do, and which gets me very curious to know your why. Like, why is Laurie doing this? Why is Laurie spending a major chunk of her life in this space? What is your why, Laurie?
Ooh, that's such a great question. I mean, my why goes way back, right? Like, I think, to when I was a kid, I always had both sort of a fascination for languages and travel, but then that led me to really see parts of the world and see inequities, right? I mean, there's inequities in my own country too, but to really see that and be like, wait a minute, this doesn't feel right. And so really then wanting to see what kind of a role could I play to help address those challenges. And the first half of my career was not in health at all. Actually, it was in sustainable agriculture in Latin America. But similar, right? They, farmers who didn't have access to markets to be able to sell their goods, like who didn't, so it's an access issue in many cases. So I think that's my why. Just really, wanting to see how I can help make a difference, and address some of the really big challenges in the world.
Well, Laurie, it's super inspiring, what you're doing, and we're all grateful, that you're building this world that has, that everybody can access health. It's such an important
goal.
thing to do. Yeah, it is. Laurie, just kind of another part to my previous question would be that since you have spent, a fair amount of time on the field as well, have you had any experiences, or can you recall like that one moment that kind of changed something in you? So I'll just explain why I'm asking this question. Like, I run a storytelling platform here, and very early on in my storytelling journey, this one particular storyteller walked up to me and she told me that just telling my story out loud gave me the kind of closure nothing ever has in my life, right? And I think that 7-8 years back kind of just stayed with me so much that even today it kind of drives me to do what I do. So do you have like a moment, perhaps on field, off field, anywhere, where you felt like, this changed something in me and this is something I'll go back to always?
I've had a lot of times throughout my career where different team members I work with inspire me, and there's so many stories I could tell. But there's a handful of people who just like stick with you, right? And I think for me, because I don't live in the countries where we're working, I'm so inspired often by my colleagues who are there and who really know what's going on and know the context. And I learned so much from them. And there's one colleague in Zambia who when this is, again, 10-ish years ago, 8, 9, 10 years ago, just watching her emerge in her leadership. She, came on to really help us lead sort of the change management side of our work, and then blossomed into ending up being the country director for the work and really engaging with donors and going to conferences. And now she leads a whole other project. And so it's working with people like her, colleagues like her, who they inspire me. And so that's like a moment. I don't know if I felt like one moment, but just kind of that trajectory with her and others like her has been really, really important in my career.
That's beautiful. That's beautiful. In fact, you did mention like another woman leader emerging, so this is something that, I'm very curious to know, because it's something that I kind of very proactively follow here when I am, running my business or curating my lineups, that I want representation. I want women to be part of the, on stage telling their stories, right? Sorry, how important is it for you to see those young women leaders emerge from these countries across the globe, as a very prominent woman leader yourself in this field?
It is so important. It is so important. And I think especially in the digital world, because it has been such a, techie has been male dominated for so long. And it's still got it still has some male domination going on in some parts, but it is amazing that there are so many women leaders emerging. And just even on my own team, it's kind of amazing that I think, my leadership team, we have one man and the rest are women. Our new director of technical services, she's a woman. Our regional director in Africa, she's a woman. So there is quite a few. Like, I was recently thinking about our leadership and past leadership, not even just my team. And it's like, wow, there's a lot of digital female leaders. And there's really great efforts going on in this too, sort of in health writ large. Like, there's the Women Lift program. There's also, I know there's an Africa Digital Women's Leadership Group. I think it has a different name, but there's some real intentionality around it that's emerging to really build, to really kind of, I guess, address that gender divide that has traditionally existed and really elevate. That said, I'm on a panel tomorrow and I'm the only woman. So it still happens.
It's a long way to go.
Yeah, we're getting there though.
Yeah. In the words of the great Beyonce, who run the world, girls.
Exactly. Yeah.
Yeah. We will get there. All right, Lloyd, this has been super insightful and super fun to just, learn your personal experiences and, of course, the tremendous, beautiful, impactful work that you're doing on the field. We have a fun segment towards the end, which is a twist to the usual rapid fire rounds that we do. This one is called Rapid Dialogue, which is our own version of a rapid fire round. I'll ask you questions and you have to give me like quick bite-sized answers.
Okay.
Yeah. But if in a few questions you want to tell me more, we're listening. So there's no pressure. Okay. Laurie, tell me, what's that one technology in digital health that excites you the most right now?
That excites me the most. I think, AI is on everyone's minds, and it excites me, and I have caution about it too. That's probably a whole other segment we could talk about. But I think specifically with AI, the ability to provide nudges to providers and patients to help really, help provide continuity of care and support in that whole cycle. I think AI can really, and is already doing that in many ways.
Right. Okay, on to the next one. What's the best piece of advice you have ever received?
I think to listen, and to really listen, and the importance around communication. That was just really prioritizing that and investing time in that.
Yeah. Okay. What's the one piece of advice that you'd like to give out to our listeners?
Oh,
Who
I
are
would
mostly
give
also just young. Sorry, I was just
yeah.
saying who are also just like young digital health professionals.
I think a piece of advice I would give is dream big. That's what I want to say. Dream big. I think that particularly, with this audience and with technology, we have no idea what else is possible. And I think especially with the youth of today, dream big, because I think that there's a lot more that can be done, and it will be the youth of today that do it.
Yeah. And while talking about dreaming big and technology, Laurie, do you have like one aha moment in your career where you were like, oh, this is possible? Oh, this can be done? Did you have that?
Yeah. I think that just staying in the digital theme, the real aha moment was when we were trying to do a system that would work offline 10 years ago, and everyone was telling us that we couldn't. And when we were able to work with the developer to get that done, to where nurses could take the system out into the field for 2 weeks, enter a whole bunch of data, come back and upload it. And it seems very common today. That was really difficult 10 years ago. And that was an exciting moment.
Wow. All right. Laurie, one word to describe your leadership style.
Collaborative. I really value having a strong team who I can collaborate with, and really everyone's a leader, right? That there's a group of leaders, that it's not just one person who's the face of everything. And so that's something I'm really working towards, is having, and we do have a very diverse leadership group, bringing different strengths to the table and coming together. So very collaborative.
That's lovely. What's that one personal habit that helps you stay productive?
Personal habit, is that what you said?
Yeah. Yes.
My calendar. I actually am very, I program in when I'm going to exercise. I program in, I have my personal, I'm going to go to dinner with somebody, as well as all my meetings. And I schedule in just desk time, because otherwise I could be in meetings all the time. So that allows me to have, I've got a 2-hour chunk, and I kind of put in, okay, I'm going to do these things. I don't ever get them all done, but the calendar.
Nice. That's a great answer. Okay. If you have, or if you could have any one superpower, what would it be?
I think it's being able to fly. I think wouldn't that be cool? I think that would be cool, being able to fly. Without a plane, right? Cool. Just me. Yeah.
Yeah. Amazing. Okay. I have 2 more questions left. One is, if you could have dinner with any one historical figure, who would it be?
Can they be alive, or do they have to be?
No, they could be. It could be actually a possibility. It's fine. It could be alive.
Okay. I think the Dalai Lama is someone who I think I would really love to have dinner with. I've read a lot about him, and I just think he would be very interesting. Yeah. There's a great book about him and Desmond Tutu and their friendship. And anyways, I think he would be a good one.
Awesome. Okay, one last question, Laurie. If you were not doing what you're doing currently, what would you be doing? What's the alternate career for Laurie?
So my alternate career, is I love to cook. And a friend and I occasionally do dinner parties. And so I would have a catering business, and I would do dinner parties.
Wow, that's lovely. Laurie, whenever I'm in Seattle next, I am definitely bothering you and coming over for dinner.
Perfect. You're invited.
All right, amazing. Well, Laurie, this was super insightful and super fun for me. I hope it was the same for you.
It was wonderful. I really enjoyed it. Thank you so much.
Thank you so much, Laurie, for just taking out the time to do this from your extremely busy schedule. And just want to thank you again for doing all the incredible work that you're doing. Just a big thank you for that. And thank you to our viewers for watching this episode. Please do like, comment, share, subscribe. Keep coming back for more and drop a comment and tell us what you think about this episode.